Hi, I'm Delusion Dispeller, and just to recap our last video, I was explaining basics of dialectic behavioral therapy in the therapy sessions in the office. Now I'm going to go into specific things that borderline patients are taught to work on during their therapy sessions. These are called stages and targets. What this means is that issues come up as they are handled, and then the procedure is that the client and the therapist move from one issue to the next as the goals are met and completed. This is how the therapist and the client do not get stuck on anything excessively, any one topic. The first topics handled are, number one, any issue that is severe enough that could cause death to the client. In other words, if this client is suicidal or talking about suicide or even thinking about suicide, that issue is addressed first and foremost. The first target is to reduce and eliminate any form of life-threatening behavior. So if the client is suicidal, having any type of thoughts that are suicidal, or any type of self-harming thoughts, or if they are self-harming, that is the first thing dealt with in CBT therapy. Then, next, behaviors that could lead to that client giving up on their treatment. So target number 2 is that we reduce and eliminate any type of behaviors that interfere with the session for the client. So if there's any behaviors that we would call a burnout behavior of people that are trying to help the client, if the client is not cooperating during the sessions with the homework assignments, maybe bringing them in sporadically instead of completing them on time and regularly. If they're skipping sessions, if they're not cooperating with their therapist in any way, shape, or form, that's the next thing we need to talk about in therapy. So we are going to definitely reduce and eliminate these behaviors. And also, we are going to reduce and eliminate hospital stays. A lot of clients have found attention by going into the hospital because that's the only way they know that they get the attention that they feel that they need for their issues. So we're going to try to reduce and eliminate that. A lot of times I believe that the phone coaching will help with that. Number 3, behaviors that are destructive in general to the client's life. So target 3 means that we need to decrease those behaviors that are destroying and ruining the quality of life of the client. So if there's fears, depression, mood disorders, eating disorders, skipping school, skipping work, not taking care of themselves medically, health-wise, spending problems, those type of issues, we want to eliminate and reduce those, and we want to replace them with attendance in school, having a good job and participating on that job in a healthy way, gaining new, healthier friends, handling money better, living in a decent, safe environment, and controlling those moods, the depression, the anxiety, etc. Number 4, the need for life skills and new ways to cope with situations other than what they've been using. So the target 4, the client will be learning new skills that will help them focus and maintain attention on the things that they need to, so that they will not be overcome by anxiety and excessive worry about their past. Also, increasing awareness of being in what they call the present moment, so that they will learn about their own feelings and get in touch with those. They will be encouraged to start healthier relationships or work on the current ones that they have, or even walk away from some that are not healthy. They'll also learn to understand their own emotions, how they function, how to feel them, how to experience them, and how not to be overwhelmed by them. They'll learn how to tolerate pain emotionally without cutting, without self-harming, without starving themselves, without doing harmful things to their bodies. So that was stage 1. Stage 2, helping the client to learn to feel feelings rather than suffer in silence and stuff them down inside. Post-traumatic stress disorder clients will be helped at this stage especially. Stage number 3 helping the client to improve their living situation so that they can experience happiness. We talked a little bit about that before, and these stages may not quite be in the right order because I personally have not started practicing this, although I really would like to when I have my practice up and running, whatever that means. So we want to work on helping them improve their living situation to attain happiness. Stage 4, unless I already said that. Going to talk to a client about finding completeness, possibly through a spiritual connection with God or a higher power, helping them experience more joy and freedom. In life outside of therapy, just like I used to experience when I would leave church. Church would be great. Everybody would be so happy and helpful and friendly and kind. And then I'd get out of church and I'd say, okay, now I got to go back to this abusive husband. How am I going to handle this? Well, it's the same thing with therapy. In therapy, everything feels like, yeah, that makes sense. It's all coming together now. But what about when that client goes home and has to experience life outside of therapy? They're having trouble balancing their actions, their feelings, what they're thinking. Well, in therapy, we teach them to integrate their very strong, passionate feelings with their logical thought. And we help them to meet their needs and their wants, also along with helping other people meet their needs and their wants when they're ready for that. They struggle to get the two integrated into one so that it's livable for that client. In dialectic behavioral therapy, what that means, dialectical, means everything works together. It's to help both the client and the therapist to get unstuck in their therapy sessions from focusing on too much need to change or too much acceptance of how things are. And it kind of keeps moving back and forth so that it can come to a balance in the end. And it helps the client to reach their ultimate goals as soon as possible. Okay. And I'm going to see, yes, I have time to tack this on the very end of this video. A little bit of research on dialectic behavioral therapy. There were 2 randomized controlled studies done where DBT was found to be more effective than other certain treatments such as cognitive behavioral therapy in treating borderline personality disorder, substance abuse with borderline personality disorder, suicidal behaviors, depression, hopelessness, anger, self-harm, self-mutilation, and eating disorders. It was found to be more effective than that because, as I said earlier in one of the videos, or possibly this one, cognitive behavioral therapy deals with focusing on what you think is what you feel and how you act. But somebody with borderline personality disorder has trouble with all of that because they were so extremely wounded and traumatized that they don't know how they think. They don't know how to act. They don't know what all of that means. And they become very, they feel very attacked, very put down. And many of them drop out of therapy. So, people that were receiving dialectic behavioral therapy, those clients were dropping out of counseling a lot less times. They were needing less hospitalization or shorter hospital stays, and they did much better with social adjustment overall. Just to give you a little bit of a tip on how some of these therapies work. There's one called GIVE, and there's a YouTube video about this. GIVE means gentle, interested, validating, and I'm trying to think of what the E is. I want to say examination, but it's basically to the effect that easygoing type of attitude towards the client. So, when counseling a client, one must be gentle, act interested, and show that they're interested, validate that client, and definitely have an easygoing attitude with them. That's just one such type of technique. There are other things such as breathing techniques to help the client stay in the moment. It's a very intricate type of therapy, but it's very, very effective. I encourage you, if you need it or you know somebody that does, please find a therapist that does it. I encourage you. Thanks for watching. God bless you. Have a great day.